Pharmacoeconomics is comparing cost and outcomes of pharmacy products or services. So it's combining what the dollar amount that you spend on a certain service or a certain product is and comparing that with the value you get for that service. I think it's very important to understand healthcare economics, and specifically in my case pharmacoeconomics, because healthcare costs are just skyrocketing in the U.S. You know, U.S. is number one in spending money on healthcare. We rank 37th in countries based on what level of healthcare our citizens get. So the U.S. is a little bit resistant to looking at cost and value because a lot of people look at that as rationing. Other countries say, if you want the government to reimburse for this drug, you have to show me cost-effective information. If it costs more, you have to show me the value of it. In the U.S., it's very dispersed. Government pays for some, private insurance pays for some, and people pay out of pocket for some. So it's a very unsystem-like system. We need to make sure that we're using our resources effectively because there's other things in this country we need to spend money on besides healthcare. One of the other issues that comes up is what about using prevention to decrease long-term cost, preventing heart attacks, preventing cardiovascular problems, preventing problems from diabetes. And the common sense answer is yes, that is a good way to spend your money. That's why we do a lot of modeling to say this many people avoid going to the emergency room each year. So a local example of modeling was in 2007, Texas expanded the number of things that they test for children with inborn disorders. We know the test costs, about $15 more per child, but what is going to be the outcome by catching some of those disorders earlier? So we modeled out and we projected that for every year of life that you saved, it did cost about $11,000. And we thought that $11,000 for a year of life, a healthy year of life, was a fair trade-off. The second example of using modeling is an international study that one of our students was from South Africa, and she was working with the Clinton Global Initiative and the World Health Organization to look at ways to improve the treatment of patients with HIV. She calculated out also for the length of life of a person with HIV and found that it cost about $13,000 for every quality adjusted life year. But in South Africa, $13,000 is a lot of money. So it was debatable whether the government in South Africa thinks that that's a good price. One of the big questions in pharmacoeconomics or healthcare economics is what is a year of life worth? I do have a book called Essential of Pharmacoeconomics. So I used the notes from my course that I had been teaching here for 10 years, put them into a book with lots of examples so that they could be used at other colleges of pharmacy, such as cost effectiveness studies, how do you measure quality adjusted life years. And a recent survey says that 80% of the colleges of pharmacy, that's the book that they use. So it brings in a lot of information, a lot of visibility to our program. We have a large program with 30 graduate students, which is probably the largest in the country. And one of the reasons that they come is because we have a pharmacoeconomics center, which is a collaboration center with clinical people, with economics people, with information technology people, and with us. So that gives them a wide base of people to interact with, which is needed in pharmacoeconomics. It's not one specific discipline, it's the interaction of different disciplines coming together to help answer these questions. So I think our access to data and our group of experts from different fields that come together in the pharmacoeconomics centers is something that attracts students to come here. I'm Dr. Karen Rascati with the University of Texas College of Pharmacy. What starts here changes the world.